Western Spring Television. Ours it is.
Good afternoon, viewers at home, and you're welcome to another edition of your medical program, Spring Clinic. In Spring Clinic, we diagnose and try to analyze all forms of diseases and injuries. Today, our focus is on radiology. Radiology, of course, you know, is a science of diagnosing and treating injuries and diseases with a medical imaging. We have in the house an expert, a consultant radiologist, Dr. WALE AJAYI, who will be dwelling on this and enlightening us about what radiologists do and how can we access the services of radiologists. Welcome on the program, sir. It's good to see you.
Good afternoon, sir.
Welcome on the program.
Thank you, sir. Thank you for having me.
You are the expert. I know simply radiology is about diagnosing, treating injuries, diseases with what we call medical imaging. Can you define it further and deepen the conversation around it?
Okay. Good afternoon, viewers. Radiology is the field of medicine that deals with imaging using X-ray and other high-energy radiations, which include ultrasound,
MRI, CT scan.
Well, CT scan is X-ray.
It's X-ray, okay.
Yeah, you know, and then we have the radionuclear imaging. And radiology is majorly imaging and diagnosis. Well, radiology is now evolving. We have what we call minimal access surgery, interventional radiology, which is the in thing now worldwide.
Let's take a journey back in history. Before radiology as a science came to being a medical science, how are medical doctors having a knowledge or diagnosing things like fractures, diseases that human eyes cannot pick ordinarily?
Commonly by detailed clinical history and clinical examination. Even on the bedside, normally, somebody had an injury, when you examine, you will know there's a dislocation here. If you examine appropriately, you know that there's a fracture here, because if the fracture is there, during examination, you can feel what we call crepitus. You know that for sure there's a fracture there's a fracture in this part of the body. And with history and examination, you'll be able to make a proper request on what you want this patient to do.
So how has radiology as a science achieved precision diagnosis in medical practice?
Well, that is an important part. Radiologists are better guided when the clinician have done their part of good clinical history taking and examination.
Yes.
So that when you just bring the patient and then you want to image everywhere, you know, but if the patient has been properly examined and proper history has been taken, you'll be able to guide yourself as, okay, this is where we're going to image. And then you'll be able to determine what are we going to do. Is it ultrasound? Is it X-ray? Or you go to higher imaging modality like CT scan, MRI. So history is to the baseline to be able to guide for proper investigation by radiology.
Are there departments in radiology you want to share with us? Are there types of radiology science? Are there departments in radiology that you want to take us into?
Yes. Just like in other departments that we have subspecialties. We have subspecialties in radiology.
Okay.
You know, that's what we call general radiology. And that you take care of everything. But this subspecialty include neuroimaging, cardiac imaging, and the like, just like you have in other area. And then you have the evolving part of radiology, the interventional radiology.
To us as laymen, we can't distinguish between a radiographer and a radiologist. Radiography and radiology. Can you strike the distinction between the two fields? Who is a radiographer? Who is a radiologist?
Okay. Both work in the same department,
right?
But the difference is a radiologist is first a doctor, a medical doctor. Then you went for residency to specialize as a radiologist.
Right.
A radiographer is somebody that went to university to study medical imaging, how to use X-ray, how to use CT scan, MRI, and things like that. So their job is majorly to take the images, while the major job of the radiologist is to interpret the images.
Okay.
But we are taught on how to operate the equipment too.
So you are saying that the job of radiographer dovetail into the job of a radiologist? Okay, they work together.
We work together.
It's a value chain.
Yes, we work together. Just like you have in the theater, you have the nurses, the scrub nurses, the anesthetists, and then the surgeon.
Okay.
So a surgeon cannot do the work of anesthetists and the scrub nurse together. So radiologists too, our major work is to interpret the images. So we have knowledge on the interpretation, on the operation of the equipment, but majorly we have interpret because we study medicine, so we have the baseline knowledge of pathology. Radiographer just study physics, then the equipment operation. They don't have the knowledge, they don't have the background knowledge of pathology that will assist in image interpretation. Although of recent, some people are already going for some short courses that they call pattern recognition, and they're trying to dabble into trying to interpret images. They cannot be, because they don't have the clinical experience and the pathological experience, the training that the doctor acquired before becoming a radiologist.
Now, you must be aware of this. And when most people, especially in the hinterland, those who can't afford the services of a radiologist or to go to the hospital, or those who have the belief, when they fracture their bones, they don't go to the hospital to see a radiologist or to see a radiographer to take the pictures, the images, and transmit it to the radiologist for interpretation and diagnosis. They patronize local people. I don't know how you accept them. Are you aware that there are people within the local setting that claim to have the mastery of straightening, of healing bones when there are fractures? Are you aware of that? And you recognize them in your field?
Yes, we are aware. And they have been the source of problem in medical practice for a while. Because many times they are referred to as traditional bone setter, and they cut through many tribes. But so common with the Hausas. Most of the time, it's not just about recognizing fracture. It's about taking the appropriate care of the fracture. Most of the time, even in teaching hospital, there are some set of patients that you don't. For instance, in the teaching hospital, we have what we call X-ray technician. After they take what we call the plaster technician. When you have straightforward X-ray, you ask them to go and apply the POP. But in some set of patients, they don't delegate that duty to anybody. It's the duty of a doctor. For instance, if a child fell and fractured the hand, the bones of the hand grows here and in the elbow. When you fracture if you fracture the wrist And a doctor with the knowledge of the growth plate did not handle that place appropriately, that bone will heal and the growth plate of the baby will fuse early. So in the long run, as the child is growing older, we will discover a differential shortage in the injured hand because there was an injury to that place that was poorly managed. The same thing, injury that are close to the joint, you need a doctor to do that so they need to make a proper manipulation so that when there is full healing, the normal function of that joint will be preserved.
It won't be stiff.
Yes, and that's the problem we're having with the bone setter. They just get there, put either wood or POP anyway, anyhow. The thing will get ill, but after they remove the POP,
the functionality
will not be fully restored.
What are you doing as a sort of advocacy campaign to dissuade people from patronizing the services of bone setters? Because we should not deceive ourselves. They are everywhere.
They are everywhere.
And you say they are causing a lot of havoc and complicating jobs for you. Eventually, the person who has messed up himself or herself with a bone setter will come to you eventually. Yeah. I find it tough to do. What are you doing as sort of advocacy so that people will start to approach hospitals, seek proper medical attention from professionals rather than going to bone setters who are cheaper anyway?
Yeah. Funny enough, they are not cheaper.
Wow.
They're not really cheaper.
Wow.
That's just the truth. And you see, the problem is...
So what's the attraction if they are not cheaper? Is it the proximity
accessibility,
or the belief?
Yes. Accessibility and the belief. So they just believe that these people can do it, so they can want to go to them.
The hospital.
I will give us a particular example. One day I went to work with one of my guys in Lagos. One accountant in a bank came. The son was playing football, the ball fell to the next compound, so wanted to jump the fence. So hit the knee against the edge of the fence and injured the bone in the knee. That's a mobile bone here. We call it patella. And the thing break into two. And the ligament of the thigh and of the leg attached to that bone. So it usually distracted. So when he came and saw the X-ray, after reporting the X-ray, I told him, I said, look, this particular bone, because of the location and the ligament attached to it, usually distracted after fracture. And I showed her, said, look, everywhere in the world, the treatment is you go to where the surgeon, orthopedic surgeon, will operate it and use a wire to hold it together. So that is standard treatment anywhere in the world. And the one was just looking at me, she got a report, and when she wanted to start going, I said, she heard that some people, traditional bone setters, are very good at assessing this. But I said, Madam, why have I been wasting my saliva in the last 5 minutes? Said, look, you can go and patronize them, but I assure you,
you will return. You
will still go back to that. So I referred the woman to Igbobi. Said, I'm sure that in Igbobi, they have an orthopedic surgeon. Said, it's not a big surgery. You just do it, attach the bone together, the bone will heal. You can leave the wire there, or you can come back and remove the wire. So it goes beyond the availability. It's the belief. Some people just believe and we don't want to come off our belief.
Then, do you think that we have enough radiologists in our climb, and radiographers, or radiology services in our climb, within the public sector, not the private sector?
No, we didn't. The same thing, we didn't have enough, we are not having enough radiographers. For instance, although now many schools are coming up, even our University Hospital that started a school of radiography, radiation physics and radiography as a course. And already, I think they have part 3, part 4 students already. And some of them come for internship, IT.
We have enough in training.
With us, we have enough in training. But now...
Let's hope they don't jump afterward.
where they used to travel out a lot.
Wow.
Because there is a lot of demand for them. But they will travel out if our government is not willing to absorb them.
Or to pay the right services, the right remuneration.
There are, and something is happening to most radiologists. We have radiologists that are working in private institutions, while we're not having enough in most government institutions. So when they wait a bit and the door is not opening,
they travel out.
They target traveling out.
Dr. Ajayi, most often than not, when you speak to patients who need the services of radiologists, or who have been told to go and do MRI or CT scan, you see them trooping out of Oshobo. Most often than not, most public medical institutions don't have this critical medical imaging equipment. Why don't we have it within the public sector? Why must people travel as far as Ado-Ekiti,
yes,
to Afe University to access MRI services or even good CT scan and others?
Yes, is government bureaucracy. You know, I discovered that if private institutions can have this equipment, there's nothing preventing government from having it. But we have this bottleneck in government and the system that pushes, that limits us and push away the company that will have been of good help. Abroad, when you equip your hospital, when they have new model of the equipment, they bring it to you. But some of them will just, are ready to even install and say, okay, try your hand on this equipment. If you like it, we will refurbish the one you are using, or we can take it away altogether. And you pay some little money. But in Nigeria, that will not happen. Companies are not allowed to transact with government establishment directly. It must go through middlemen, where our problems comes from. You know, and
I'm aware there's a company called General Electric,
yes,
and they trade in all of these medical imaging implements,
yes,
and they are willing to sell. So you mean that they can't sell directly to public institutions? They have to deploy through a contractor,
yes,
who will complicate the process.
And everything goes back to what's called due process. You know, they will call it due process, but it prolongs our things. By the time a contractor gets equipment from the company, you sell it for almost double to the government.
Due to lack of access to medical imaging, how many patients, how many lives do you think we lose on the average per annum?
I cannot estimate. It is even beyond loss of life. It is the inestimable morbidity that that is associated. For instance, somebody had a stroke. There's some stroke that you can reverse if you make the diagnosis within few hours. Somebody had an infarctive stroke. A blood vessel in the brain got clotted. If the CT scan or MRI is available in the institution, they can do the imaging, and then you can make that diagnosis. And there are some drugs that you can give to the patient to lyse the thrombus, and blood supply to that part of the brain will be reinstated, and the patient will recover very well with little or no limitation post-recovery. But when patient will have to travel to Ado, that will be a whole day journey. You know, or they have to go to
additional pressure, additional stress.
The stress and everything. By the time they come back, maybe they came back in the evening, there's nobody to assess, to review the image again. They wait to the second morning. The damage to that aspect of the brain is complete. Because commonly, It's permanent. If you are able to recover some, there will be significant morbidity. And that's the importance of medical imaging. When you have it within the system, be able to, salvage many lives and limit the morbidity.
Dr. Wale Ajayi, I know that biomedical engineering and medical imaging is now the in thing outside the shores of this nation. It quickens diagnosis and it gives precision analysis and diagnosis. You have said that we are losing a lot. What do you think government should do in concrete terms so that this important aspect of medical science can actually come to play, that we can deploy it appropriately?
Well, I would advise that if government can embrace direct transaction with company, I'm sure you'll go a long way to help us. Most of those companies, they come around. You don't even need to invite them. When they see you, the prospect of your hospital,
the traffic of patients,
they come in, say, okay, we can supply this equipment for you, we can give you this, and they even give you room to pay overtime. So if our government can step down on the policy, especially for health sector, they can maintain their due process with other places. But when it comes to health sector, they step down on many of those policy and bureaucracy. It go a long way to liberalize things, and then some of these equipment will come in and then allow us acquisition of those equipment and then better access to them.
So one, I will call it affliction, but I call it disease. One disease that is ravaging this generation of humanity is cancer. And somebody told me, an expert like yours, that early detection may stem the tide of the growth or the spread of the cells. How important is medical imaging to early detection of cancer?
Medical imaging play a very strong role in early detection. Cancer all over, and one problem we're having this side of the world is people don't come to assess
medical services
early for screening. For instance, at a particular age, you need to come in, do routine checkup. For instance, okay, one of the commonest cancer, the breast cancer. From age 40, you should come in to do routine examination. Commonly 40, 45 is still in between most places. 40, for people that have family history of breast cancer, they are asked to start 5 years earlier. Maybe if somebody's sibling developed breast cancer at the age of 45, he must start screening other sibling, female, at age 40. And commonly you do a scan or you do a mammogram, X-ray of the breast. And so most people don't take it to heart that they should come and do medical checkup. And it's early detection that allow for proper and full treatment to achieve cure. The moment that time is not captured, we have what we call, most cancer metastasize, go to somewhere else. The breast can go to the axilla and then go to any part of the body.
You can go to the breast, Dr. Ajayi. I'm going to take you on this medical checkup. How important is this for us to do routine medical checkup? Run on or quarterly, or how many years interval so that we can stay healthy? Yes, my guest has been Dr. Wale Ajayi, a radiologist, an expert and a specialist, taking us through the jobs of a radiologist and what is radiology all about. This is Spring Clinic on Western Spring Television. We are going on a short break. We shall return shortly to continue the discussion with Dr. Wale Ajayi. See you on the other side of the divide.
Nigeria once had giraffes, rhinos, and cheetahs, but we have lost this iconic species forever. And we may lose our lions, elephants, and gorillas too. Be iconic and join me to protect our wildlife. Report wildlife crime and say no to illegal bushmeat, because poaching steals from us all.
New York nílùú ńlá tó tóbi jù nílẹ̀ Amẹ́ríkà. Kódà iye ènìyàn tó wà níbẹ̀ ló fi ìdá méjì ju ti ìlú Los Angeles lọ. Ó jẹ́ ibùdó fún oríṣiríṣi àṣà, ìgbafẹ́, iṣẹ́ ọnà, ìmọ̀ ẹ̀rọ, òṣèlú, ẹ̀kọ́, ọrọ̀ ajé kódà tó fi máa rẹ́ ìdárayá. New York yìí ló gbàlejò ọ̀pọ̀lọpọ̀ olùdókòwò kárí ayé tó sì fẹsẹ̀ múlẹ̀ gidi gan ni. Ìdí nìyí tí àwọn kan fi máa ń pè é ní olú ìlú orílẹ̀-èdè àgbáyé. Ohun ìdámọ̀ tó gbajúgbajà jù ní New York ní ère òmìnira Statue of Liberty, eléyìí tó ń ṣàfihàn bí ìlú náà ṣe fàyè gba onílé àtàlejò. Bẹ́ẹ̀ sì ni afárá Brooklyn kò lẹ́gbẹ́. Ó kéré tán ẹgbẹ̀rin ní oríṣi èdè tí wọ́n ń sọ ní New York. Èyí ló sì fa bí wọ́n ṣe máa ń sọ pé gbogbo èdè àgbáyé ló pé sílùú New York. Ní nǹkan ọdún 1624 ni àwọn èèyàn ẹ̀yà Dutch tẹ̀dó sí ibi tó ń jẹ́ New York báyìí. Amsterdam ni wọ́n ń pè é tẹ́lẹ̀ nígbà náà, àmọ́ lọ́dún 1664 ni wọ́n yí padà sí New York lẹ́yìn tí ọba King Charles kejì tilẹ̀ Gẹ̀ẹ́sì fún arákùnrin rẹ̀ ní ilẹ̀ ìyẹn Duke of York. Láti ọdún 1785 ló ti wá di olú ìlú ilẹ̀ Amẹ́ríkà títí di òní olónìí. Ó jẹ́ ìlú ńlá tó kún fún ọ̀pọ̀ iṣẹ́ ọnà àti ibùdó iṣẹ́ àtinúdá oríṣiríṣi fún gbogbo ìran ọmọnìyàn. Ìlú New York lórílẹ̀-èdè Amẹ́ríkà.
Bẹ́bíró gbélémọ̀dàwòrò kọ́ọ̀dé má dìbò sí. Bá ṣe gbé ètò yìí kalẹ̀ láti lè jẹ́ kóníkálùkù fi ṣe òdiwọ̀n ìdílé wọn. Òtítọ́ ọbẹ̀ ni pé kò sí ìdílé kan tí ò ní ìpèníjà àti ẹ̀. Ṣùgbọ́n àtẹ́lẹwọ́ ẹni la fi ń tún ẹni ṣe. Àti oníkálùkù bá kọ sí ìpèníjà náà ìdílé yóò sọ bí ìdílé yóò ṣe rí. Bẹ́bíró káfinúkonú káfikùnlukùn pẹ̀lú àwọn lọ́kọláya lọ́lọ́kan òjọ̀kan lórí ètò. Níbẹ̀ lọ́mọ Afọlábí ó ti mọ tàkò tó béèrè sí wọn. Láláì fìkan pé méjì lórí ọ̀rọ̀ tó ń dá òwòhòwò sílẹ̀ nínú ìdílé. Bẹ́ẹ̀ sì làwọn àlejò náà yóò mọ jẹ́ ká mọ ọ̀nà tí wọ́n ń gbé gbà sílé wọn ò fi dàrú tí fi ń tò. Bẹ́bíró ẹ máa pàdé Múyìwá Àfọlábí lórí ètò yìí ní gbogbo ọjọ́ àbámẹ́ta láago 8 òwúrọ̀ tí àtúntẹ̀ rẹ̀ ó sì tún máa wá láàrin ọ̀sẹ̀ ní ìkànnì móhùnmáwòrán Western Spring Television ìkànnì 150 lórí StarTime. Bẹ́bíró tọ̀sẹ̀ yìí ó máa yàtọ̀ ní kò ní yàtọ̀ fọ́.
Àbújá ni olú ìlú orílẹ̀-èdè Nàìjíríà lọ́wọ́lọ́wọ́. Ọjọ́ 12 oṣù 12 ọdún 1991 ni wọ́n gbé ibùjókòó agbára Nàìjíríà kúrò nílùú Èkó lọ sílùú Àbújá lásìkò ìṣèjọba ológun ọ̀gágun fẹ̀yìntì Ibrahim Babangida. Ìlú Àbújá ní ìlú kẹjọ tí èrò pọ̀ sí jùlọ nílẹ̀ Nàìjíríà. Ó sì jẹ́ ìlú olódi tó wà ní àárín gbùngbùn. Gbogbo àwọn ilé-iṣẹ́ àti àjọ ìjọba kọ̀ọ̀kan ló ní olú ọ́fíìsì wọn nílùú Àbújá, gẹ́gẹ́ bó ṣe jẹ́ pé ibẹ̀ gan ní ibùjókòó agbára ìṣàkóso ilẹ̀ Nàìjíríà. Lọ́dún 2003 ni àjọ Commonwealth gbé ìpàdé wọn wá síbẹ̀. Bẹ́ẹ̀ sì ni àjọ olókoòwò nílẹ̀ adúláwọ̀ ṣe lọ́dún 2014. Kódà lọ́dún 2016 àjọ tó ń rí sí ọ̀rọ̀ àwọn ọmọdé ìyẹn UNESCO gbà á gẹ́gẹ́ bí ibùdó ìkẹ́kọ̀ọ́ wọn. Díẹ̀ lára àwọn ibùdó tó gbajúgbajà nílùú Àbújá ni àpáta agbára Aso Rock, ilé aṣòfin àpapọ̀, ilé aṣojúṣòfin ilẹ̀ yìí, àpáta Zuma Rock, Millennium Park, báńkì àpapọ̀ ilẹ̀ Nàìjíríà CBN, cbn mọ́ṣáláṣí àpapọ̀ àti ibùdó ilé ìjọsìn àpapọ̀ àwọn kìrìsìtẹ́nì. ẹkùn ìdìbò 6 ló wà nílùú àbújá: abaji, buhari, gwagwalada, kuje, kwali àti abuja municipal. kílìṣì tó jẹ́ ohun ìpanu tí wọ́n fi ẹran pèsè ló jẹ́ oúnjẹ tó wọ́pọ̀ tí gbogbo èèyàn sì nífẹ̀ẹ́ sí nílùú àbújá. ó jẹ́ ibùdó ìsinmi fún ọ̀pọ̀ àwọn arìnrìn-àjò láti ẹkùn kọ̀ọ̀kan nílẹ̀ nàìjíríà nítorí pé àárín gbùngbùn ló wà. ìlú àbújá rèé o, ibùdó agbára ìṣàkóso ilẹ̀ nàìjíríà, ògo ilẹ̀ adúláwọ̀.
nínú àwọn ìran àti ẹ̀yà tí ìbejì ti wọ́pọ̀ sí jùlọ lágbàáyé ni ìran yorùbá jẹ́. yorùbá sì máa ń ṣàjọyọ̀ àwọn ìbejì gẹ́gẹ́ bí olú ọmọ, pàápàá nínú àwọn ìpèdè tó ń ṣe àfihàn oríkì ìbejì. ẹ ó máa gbọ́ wíníwíní lójú orogún, èjìwọ̀rọ̀ lójú ìyá ẹ̀, ọ̀bẹ kìí ṣe bẹ́kìṣà, ó bẹ́ sílé alákìísà, ó sa alákìísà donígba aṣọ, àfijù ọmọ tí gbàdọ̀bálẹ̀ bàbá, ọ̀kan bá bí èjì ló wọlé tọ̀ mí wá. yorùbá nígbàgbọ́ wípé orúkọ ẹni nìjánu ẹni, bẹ́ẹ̀ ni wọ́n sì gbàgbọ́ pé orúkọ ọmọ a máa ru ọmọ. ìdí nìyí tí yorùbá fi máa ń ronú jinlẹ̀ kí wọ́n tó sọmọ lórúkọ. ètò akọ́mọlédè ló ń dé sójú ìwòran yín láti iléeṣẹ́ móhùnmáwòrán WSTV ìkànnì 150 channel 190 lórí StarTimes. Folúṣọ́ Ayaolúwagbémiga, ìyá ìjọ pèdèpèdè, ìyá akọ́mọlédè ló kọ tèmi. yorùbá dùn púpọ̀, yorùbá ò lè kú, yorùbá ò lè parun. tiwa làṣà, tiwa lèdè, tiwa nìṣẹ̀ṣe, akọ́mọlédè.
Fumilayo Ransom Kuti was an educationist and advocate of women's rights. She was recognized for her vitriolic comments against colonial policy of taxation as it affected the Nigerian women. Bere, as fondly addressed by her women followers, Fumilayo championed the initiation of universal adult suffrage, which gave an unprecedented leeway for women to contest elective offices and power to exercise voting rights. Married to a foremost educationist and teacher, Israel Oladotun Ransom Kuti, the first president of Nigeria Union of Teachers, Fumilayo Ransom Kuti was the mother of children who inherited her spirit of activism. Olufela and Be Ololari, the former, a renowned musical legend. She was the first female student of Abeokuta Grammar School and the first female to own and drive a car in Nigeria. The award recipient of Member of Order of Nigeria MON and Lenin Peace Prize, was born on 25th October 1900 and was killed on 13th April 1978 by rampaging road soldiers in Lagos. Western Spring Television identifies Fumilayo Ransom Kuti as a watershed character in history.
Sports is a culture on its own. It has its own language, its own people, with their own way of life. The world of sports is never void of actions, stories, dramas, and scandals. I guess you need a sports show that can walk the walk and talk the talk.
On this show, we answer all your sporting questions. The whens, the whys, the wheres, and even the what ifs. Sports Spring is that show that will give you that new lease of life you've been looking for in sport journalism. Join me, Joseph Atewe,
And your sports Amazon, Nengi Ernest.
on this station, Western Spring Television, channel 190, only on StarTimes.
Let's talk sports. Let's speak the most universal language of the world.
Every wild animal serves a purpose in a balanced and functioning ecosystem. But demand for bushmeat can destroy that balance. Deforestation and trade in live wildlife put us all at risk of disease outbreak like Ebola, Lassa fever, and even COVID-19. We can all help prevent extinction and diseases by saying no to illegal bushmeat. Keep them wild and keep us safe.
Welcome back on Spring Clinic. Dr. WALE AJAYI is very much in the house. Sir, thank you for being there.
Thank you, sir.
Yes, we were talking about routine medical checkup. And we were saying that why is it not a culture in this part of the world for us to take routine medical checkup as seriously as we take payment of school fees, as we take maintaining our cars, servicing our cars, changing our television, changing our furniture, and attending to other things around us? Why is it not a culture? Why do we shy away from paying attention to our medical well-being through routine medical checkup?
I think we just needed some reorientation. We are not putting enough importance on it, and we want to wait until there's trouble before we start looking for a way to prevent them. You know, although generally the one of the major problems is the level of poverty in this side of the world. You know, and our health insurance has not so much helped to some extent.
But it's there, and it's helping.
It's helping, but it's not helping. You know, the people that are benefiting from it, they are still low compared to the general masses. So I think we just need some reorientation.
Can you tell us, on the average, how much will it cost me to do a thorough medical checkup and assessing radiology services, medical imaging? On the average?
It varies, and it has to do with age.
Okay.
For instance, a young person, we just need to do just a chest x-ray to look at your lung and your heart, do an abdominal x-ray to check the major abdominal organ. Guys, when there's another problem, you don't do much than that. Well, as you grow, as
somebody between the ages of 15 and 60,
even from 40,
okay,
you can start doing that. You know, and with a more advanced age, we would like that person to do. He wants to do a screening. Okay, if somebody higher wants to do a screening for breast cancer, prostate cancer,
brain,
colonic cancer,
okay,
and things like that. We want to do brain, and so in the range, a CT scan.
One of the ENT aspects,
yes.
The ears, the throat.
Nose and throat. That is more towards the general checkup. They will look at that. If they find something there, okay, let's go ahead and
cover by radiography.
They will still have to come to us on the long run, but the ENT surgeon will first examine that. If they felt he needed an imaging, can request for it. And a CT scan of the head will be able to take care of most of the thing in the ear, nose, and throat.
Have you listed all diseases that one should screen for in this? Have you listed other? Are there other things you want to mention that is important that we check up for when we go for medical checkup? And what the services of radiologists?
Commonly, you have the breast, you have the prostate, then we have the intestinal tumors. Especially and those you can do in radiology. Then you have some aspects that you use lab to take care of. So for breast, the woman can come for mammography,
and is under
from
your
age 4.
Okay.
Yes, it's under our jurisdiction. Then you want to do a CT scan of the brain to see if there's any trouble there. Then CT scan of the abdomen to check the intestine, the prostate.
Speaking as a man, an average black person should be worried about the possibility of prostate cancer or prostate enlargement. At what age should a man start to check for prostate from a radiologist?
If they are asymptomatic, we know that prostate cancer is commoner in advanced age, 50, 60, and above. And at lower age, between 40 and 60, commonly is the benign prostate enlargement that is commoner, which drug can take care of, or routine those surgery if it's causing obstruction. If it's not symptomatic, they can just give them drug to improve this thing. I think majorly that's a job about the common one.
Breast cancer, that's another worry.
Breast cancer,
for an average lady.
For an average lady, breast and cervical. You know,
cervical is covered by radiologists.
No.
Okay.
But partly, when they have findings, they ask them to come and do scan. Okay. But commonly, the screening aspect in medical screening is pap smear and things like that. Okay. Pap smear, they can get if something is going on early.
Now, let me share this with you. I just returned from Britain, and a friend of mine, Wale, just suffered a partial stroke. And this is a guy that did regular medical checkup in England, but he still was caught up with stroke. As I speak to you, he's recuperating. I want to ask, what went wrong the last time he went? What can medical imaging pick in stroke, before stroke happens or stroke strikes? Or what signs do you see? Or what symptoms do you see? And it will tell you that, hey, we trigger it that I need the services of radiologists. I need to check up myself. What are the signs and symptoms will a man or a woman notice that we cook in his or her step to the office of a radiologist for medical imaging?
Well, the person that you're talking about, I don't know the medical history.
That's right.
But most of the time we know stroke is commoner with patients with hypertension. You know, and then some other people affected are patients with diabetics, because diabetes mellitus has comorbidity. When somebody develops diabetes, you should be expecting hypertension to come, because excessively elevated blood sugar affects the blood vessel, make them to harden, so the patient will become hypertensive over the time, and things like that. So most of the time, wanting to stem that early, if somebody is hypertensive, you must learn to do routine check. For instance, one of the routine check they do is echo. Echo, we found out if the heart, because the heart is like a water pump. You know, when you are pumping water and you partly close the tap, the lock, you are giving the pump a lot of work. The same thing in hypertension. When BP is high, you are giving the heart more work to do, and that will start affecting the heart. If the heart gets bigger, it can start developing clots in the heart, and then you can send it to the brain, and things like that. So the patient will start, if it's hypertensive, you must take care of that hypertension. If the patient has diabetes, you must make sure that his blood sugar is properly controlled.
High cholesterol, is that a danger signal?
Yes. High cholesterol may come in by itself. Some people that have tendency to develop high cholesterol because of their constitution. So from age 40 and above, to be part of the regular routine check that they should be doing. And the moment they so that is getting higher, there are drugs to lower it.
Like aspirin?
Aspirin is
also is a blood thinner.
Yes, it's just to prevent blood clotting in the blood. You know,
it does not fight cholesterol.
No. Yeah, there are drugs specifically to modify body metabolism, so that the body will now, you know, it gets all those bad cholesterol out of the system. Then they will ask patients to do some dietary modification.
If you notice that your word is getting slurred and you're having cerebral palsy, is that enough signal to approach a radiologist? I mean, the vein, you feel that your side of the face is getting weaker.
Even at that point, there's already a problem coming up.
Wow.
So commonly, some of those things, for instance, earliest sign of somebody's BP not control is they have this persistent headache. Even just ordinary headache, like for instance, persistent headache is an indication to go and have a CT scan done.
Don't take a paracetamol.
Yeah, don't take paracetamol. Somebody had a headache, took paracetamol, the headache came back, and it's persistent over a few days. Get something, check your BP. Your BP is normal, then get something done, get a CT scan, and it may show a highly tumor, or it may show something else that can be, stem early and prevent future morbidity. But most of the time, we ignore many signs in this side of the world.
Let's take this discussion home now. You practice here in Osun State, I assume.
Yes, sir.
Do we have these facilities around here? Enough facilities to access medical imaging? But I don't want people go to Ibadan to make cure or Afe Babalola University in Ado-Ekiti when they have prescriptions from doctors in the hospital.
We have, but it's not adequate. Few centers in town had good imaging facility, especially CT scan. Our teaching hospital is not. Our CT scan has been done for over 5 years. And we don't have MRI. We have never had MRI,
which is the ultimate.
We have never had
the ultimate?
MRI. It's not particularly the ultimate. It's just part of the equipment we should have normally in a standard teaching hospital.
So you need the services often.
Yes, because you need MRI. MRI is the best imaging modality when it comes to CNS imaging the brain and the spine.
Okay.
Because it has the best soft tissue differentiation capability. And with it, the neurosurgeon is settled. He's good to go and do his job without limitation. So in town, we don't have enough. We don't have enough. If the just we did not have,
I wonder, general hospitals, primary health care centers, and private hospitals. So I want to thank you for coming on Spring Clinic. It's been a pleasure sharing your knowledge, and we do appreciate you on this program. Thank you so very much for coming. Viewers, our guest has been Dr. Wale Ajayi, a radiologist, a specialist, who has been with us for about 45 to 55 minutes, sharing his wealth of knowledge about medical imaging, radiology, and how to get well as humans. Till next week, when another edition will be brought to your viewing pleasure, I remain yours sincerely, FEMI ADEFILA, saying bye for now.